Good morning, everybody, and welcome to the fifth webinar of the Global DAT Task Force of 2024. Pleased to see you all joining. My name is Job van Rest from KNSV TB+, and I will be facilitating the webinar today together with my colleague Juan Barrios. The webinar will be about global hosting versus local hosting. In previous webinars, we talked about the technologies that are out there, different DAT options, also on the platform side of it. And today we will talk about the underlying infrastructure that is needed to host these platforms in countries. We have two speakers that I will introduce when they start their presentation. All right, with that said, quick overview of the outline of the sessions today. First speaker, Kelly Collins, will share her experience on cloud hosting in general, how this typically works for applications, what type of hosting solutions are available, and then based on that, also her own experience with hosting DAT intervention in a variety of countries. Next to that, we will have a short question and answer session for Kelly, and then we start the second part of the webinar, where Vasile Bounegru will present on hosting options for DAT interventions, also what factors to consider for countries when selecting hosting solutions, how you put these steps in order in decision making for your solutions, and also experiences from Moldova and several other countries in the Central Asian region. With this short introduction, I would like to now introduce Kelly Collins. Dr. Kelly Collins is a global public health expert, social entrepreneur, and infectious disease epidemiologist. She is currently the CEO and co-founder of SureAdhere, and currently serving as the Vice President of Digital Adherence for Dimagi. She specializes in developing and evaluating digital health interventions for populations affected for TB and HIV. And Kelly has over 15 years of experience implementing digital health intervention and has directly influenced WHO and CDC TB treatment guidelines regarding supporting tools. With that said, Kelly, I'm excited to hand over to you to start your presentation.
Great. Thanks so much. Very, very wonderful to be here. Thank you, Job, and to KNCV and the task force for having me join this webinar. This is absolutely a topic that is near and dear to my heart, as we've worked with many organizations and countries as they've made decisions around hosting digital adherence technologies and different types of software applications. So thank you for having me here. So I'm just going to get in today, again, as you have mentioned, into global versus local hosting options for digital adherence technologies and talk through different types of hosting. We're going to start the presentation today by talking about what do we mean by hosting? What does it mean to host software? I find that that's a good place to start because there are some common misconceptions around what it means to host software. And then we'll get into the different types of software hosting available. We'll talk about hosting in the context of digital adherence technologies. I'll bring about some key hosting things. And then I have sort of a sample hosting assessment that we've run through with a number of our partners. So we'll go into that as well. So I will just go ahead and jump right into this. So what do we mean by hosting? You know, back 20 years ago or so, software was typically installed on a local device or a local server that sat within an organization's premises. And so that's what we meant by hosting, you know, maybe 20 years ago or so. And this concept has evolved to today, where hosting really actually is not just about hosting locally on a device that's sitting in an office or your home. What we mean is that we are deploying software applications and data storage solutions on secure remote servers that are managed by an internal or external hosting provider. This can ensure that data and applications, software applications, are accessible over the internet while maintaining the required security, compliance, and performance standards that are required. And really, by leveraging hosting solutions or hosting services, organizations really are able to maintain their focus on core operations, knowing that their digital assets are maintained, protected, and available whenever they need them. So the concept of hosting is actually a spectrum. It's not sort of a black or white issue at this stage. In today's digital landscape, hosting solutions really just aren't one size fits all. Every government and every organization has unique requirements and priorities around hosting. Some might need on-premise hosting to ensure complete control over their data and maintaining stringent data sovereignty, for example. Others might opt for cloud-based solutions to really leverage scalability and cost efficiencies available today. So in between these two sort of options of on-premise versus public cloud, there are hybrid models that combine the best of both worlds that really offer flexibility and adaptability for organizations. So by tailoring these hosting solutions, we can assure that not only data sovereignty requirements are met, but that also high availability needs are met, robust security measures are taken, and a customized approach can kind of guarantee that the hosting environment is really optimized to support the specific goals of each organization that's rolling out a solution. So what are the different types of hosting that are available? I'm going to talk about each of these in depth because I think it's really helpful to get into what do we mean by on-premise, or what do we mean by locally supported hosting options. So I really want to get into sort of the in-depth look at each of these options. So when we talk about on-premise hosting, what we mean is that we are hosting software using physical servers and hardware located within an organization's premises. Some examples of traditional IT, of sort of on-premise hosting are traditional IT infrastructures. So perhaps, hospital data centers that are located within a hospital, office-based data centers or server rooms that are, we used to have server rooms in large office buildings, for example. That's what we mean by on-premise. There are definitely some benefits to on-premise hosting. The first is that you maintain full control over the hardware and the software environment that you've deployed. From a security standpoint, hosting on-premise can provide enhanced security because you're controlling the server room, for example. You control the connections to the internet, for example. But I will mention in just a moment that security from an on-premise standpoint can be difficult. From a customization standpoint, though, it does allow you to completely customize the infrastructure and the environment to your specific needs. So on-premise hosting is absolutely still something that happens, but there are many drawbacks to this option that many organizations are unable to overcome today. So some of the cons that we see are really heavily related to cost and resource management. So in terms of cost, there's a high initial capital expenditure needed to maintain on-premise hosting and really on these ongoing maintenance costs. It's also not very scalable. Scaling can be very expensive and time consuming because every time you need to scale your environment or scale your user base, you actually have to add hardware infrastructure, and that's on your organization to add that hardware infrastructure if you're thinking about on-premise hosting. And that means you need to buy more computers, for example, more servers. You need to invest in the latest technology. So again, from a scalability standpoint, on-premise hosting can be very cost and resource intensive. Also, from a management perspective, it required significant in-house expertise and resources to manage and maintain these server systems. So you need to have the necessary skills and resources available in order to stand up very complex hardware, for example. And then from a security standpoint, sometimes on-premise hosting can lead to actually diminished security and compliance if you don't have the required or necessary policies in place that really, ensure that your local on-prem team is securing the hardware properly. For example, using, strong password requirements and firewalls and things like that. So some of the takeaways here, on-premise hosting can be really good for an organization in the sense that it gives you full control over your assets, but it does come at a much higher cost and requires in-house expertise. So moving next to the concept of the private cloud. Private cloud is essentially cloud computing resources that are used exclusively by one organization. These resources can be hosted both either on-premise, so perhaps you have an on-premise cloud that has, a very large data center, for example, or a private cloud that's managed by a third-party provider, or it's being leased, ensuring really dedicated and secured access to cloud services, but that are tailored to your organization's needs. So for example, maybe a financial institution would use a private cloud to securely manage sensitive customer data and financial transactions, benefiting from really this enhanced security and compliance without sharing infrastructure with other organizations. So some of the examples of this are VMware vSphere and OpenStack. These are commercial examples of private cloud options. Again, some of the benefits of private cloud: clearly greater control over the environment and resources. From a security standpoint, enhanced security as the resources are not shared with others, and you can actually invest from a private cloud perspective in some of the more up-to-date security measures. And from a customization standpoint, a private cloud really can be tailored to meet your organization's specific needs. From a drawback standpoint, costs are much higher, clearly, in a private cloud because you are, again, have the need for dedicated hardware and infrastructure in hosting this private cloud. The management requires more in-house management and expertise. Again, you need the necessary IT and sort of infrastructure skills in-house or within your organization to maintain a private cloud. And then from a scalability standpoint, more scalable than on-premise, but still less flexible compared to a public cloud, where scaling, it really can be more complex and costly because you do have to add servers as you scale if you overtake sort of what the server was initially built for. So some takeaways from private cloud: definitely gives greater control, enhanced security, but comes at a much higher cost. So hybrid cloud. Hybrid cloud really is meant to combine public and private cloud environments by allowing data and applications to be shared between them, installing cloud tools on a local or on-premise server. So this is a great option. One of the examples here, Microsoft Azure Stack or AWS Outposts. This gives you the ability to take some of the public cloud tools, bring them to your private cloud stack or your local server infrastructure, and allow you to run, next-gen software applications in an on-premise server by using, cloud tools on private systems. An example of this might be a healthcare organization using a hybrid cloud to, for example, maintain patient records. What this means is that, the organization might be able to store sensitive patient data on a private cloud while putting your less sensitive applications on perhaps a public cloud, like your appointment scheduling software or your things where you're not communicating directly with a patient. Maybe it's your billing, for example. Those things might be more easily hosted in public cloud. So what you're really doing is you're leveraging both options. And the setup ensures both high security for critical information and is flexible for sort of your other operations. From a benefit standpoint, clearly flexibility gives you the ability to choose between the optimal environment for your workload. From a cost efficiency standpoint, there can be a good balance between cost savings and performance as you're making decisions about where to store sensitive data and where to store cloud-based or less sensitive data. And then from a security standpoint, sensitive data can be kept on a private cloud while taking advantage of these public cloud options for, again, your less sensitive data. So definitely gives you more flexibility. From a drawback standpoint, it can be highly complex to run a hybrid cloud system because you do need to integrate your two workloads. You need to be able to maintain and have access to your private and sensitive data while also maintaining sort of this other system that's running in a public cloud. That does mean that it can have low interoperability. And it really, if you're trying to implement seamless integration between the two options, it can become complex and challenging. And you need to have, for example, potentially higher costs to create this interoperability and to create the seamless interactions between the two systems. And then you also have to maintain both environments. So again, cost can become an issue with a hybrid cloud. From a takeaway standpoint, though, a hybrid cloud is highly flexible. It gives you balanced security and the ability to potentially, weigh your costing options in order to take advantage of sort of private cloud and local storage solutions, while also getting some of the benefits of cloud tools. So it can be complex to manage, but give you some flexibility in where and how your data is stored. Great, so then I'm going to move on to this concept of managed hosting. Managed hosting is something that we've actually found to be very sort of well received with many of our digital adherence partners. The concept of managed hosting means that you're essentially leasing dedicated servers and hardware from a hosting provider, who then manages that hardware and your network. An example of this actually is one of SuredHere's digital adherence partners. So we work with the NHS in the UK, and the NHS has essentially leased server space via an NHS approved cloud provider. They have a team that sits in the UK that actually manages all of their locally hosted systems, and SuredHere comes in and just provides the software. And so they manage the network, they manage the data storage, we provide the software and the code base and ensure the software is debugged and things like that, but ultimately they maintain the network. And so a managed option is really great. Another example of this might be Rackspace or Liquid Web. So there are some other commercial options out there for managed hosting. Some of the pros of managed hosting, really reduced management burden as your provider handles this infrastructure maintenance. So you don't have to maintain those things in-house. There are high performance, definitely benefits where you have high performance, high reliability, and really dedicated resources for your organization. And then from a support standpoint, you don't have to maintain these folks in-house. You can contract with a managed service provider. You have access to expert support and managed services, and then you don't have to have those skills in-house. Some of the drawbacks of this, again, higher costs compared to really unmanaged hosting or a public cloud, but probably less so than private cloud and maintaining those resources in-house. So I think this is a good option if you're trying to maintain control of data while also managing your costs and resources. From a flexibility standpoint, it can be less flexible to fully managing your own infrastructure. But I think, again, ultimately it kind of is a very middle of the road approach. And then from a dependency standpoint, dependency is actually on the provider for maintenance and updates. So this can be an issue if you don't have a really reputable managed hosting provider. And we've actually seen the partner that we work with in the UK is fantastic, but we've actually seen examples of very poor managed service providers, and that can cause stress and anxiety. So definitely something that if you're choosing a managed service option, that you would want to put out a really strong bid. You would want to make sure that you feel very comfortable with the partner that you're working with, and really maintain that relationship. So some of the takeaways of managed service, it really does have reduced internal management burden, potentially higher cost than a public cloud, but still less so than private. And it does give you the benefit of external expert support. And then the last one on the other end of the spectrum, and there are other options out there, but I'm going to speak to these 5 today, is the public cloud. So, when we think about public cloud, this is kind of the typical Microsoft Azure, AWS, or Google Cloud. It means that you're hosting your software solution on services provided by a third-party vendor over the internet. So some of the pros of hosting in the public cloud are things like scalability. You can easily scale your infrastructure to meet fluctuating workflows. You can start small, add infrastructure as you go, and you can do that really sort of infinitely, which is great. From a cost efficiency standpoint, it's really pay-as-you-go model. You don't have initial capital expenditure on hardware. You don't have ongoing maintenance costs of hardware. That really is on the cloud provider to do that. From an accessibility standpoint, it's accessible anywhere with an internet connection, and you do have rapid access to the latest technologies and services when you're using a public cloud. Whereas if you're maintaining these resources internally, in order to have access to the latest technologies, you actually have to do the work to install them yourselves. So definitely some benefits to using a public cloud. Also, there are some drawbacks. From a control standpoint, you absolutely have less control over the infrastructure. For example, where it's located, the physical security of the data centers, all of those things really do need to be put on the cloud provider. So an important consideration. From a security standpoint, shared resources can raise security concerns. So for example, maybe you're in a data center with hundreds or thousands of other individuals where your data is located in those data centers. So that can be concerning for organizations. Though I will say that from our experience, major providers really do offer robust security measures and compliance with local regulatory and rules, because it's so important to their business to maintain those security measures. And then the last thing is really around compliance and data sovereignty. So I think this is the big one that we see with digital adherence technologies is, can these public cloud options meet local regulatory requirements for data security, data sovereignty, geographic hosting requirements, for example. Those things can be a major challenge with cloud providers that aren't, in every country to this stage. So some of the takeaways here: clearly public cloud offers high scalability and cost efficiency, but also much less control over your data. So I want to talk a little bit next around hosting in the context of digital adherence technologies and in the context of Assured here. I'm going to speak to Assured here because that is, and Dimagi's hosting, because that's the experience that I have, although many of you might have other experiences. So looking forward to hearing about those in the Q&A session. But I just want to first talk really quickly, Assured here was originally sort of designed and developed in the US, but we very quickly scaled into international environments in high burden TB regions and also in lower burden TB regions in Europe and Asia. And I think that we have had many requirements come to our organization from different government TB programs globally. So the first one that I'll go to is in North America. So I want to highlight how we host our system in the US. In the US, we support roughly 360 US health jurisdictions. When we first started out deploying Assured here back in, I guess, 2010 to 2014, we were actually using local infrastructure at the University of California, San Diego. We then redeployed on the public cloud in around 2012 on Microsoft Azure. And we use what's called a multi-tenant system that is scaled through containerization. That means we can actually automatically scale up our environment as the user base comes online. So in the morning, we can use fewer servers. Maybe midday, when the entire country is using the system, we can scale up to more servers and then scale back down at the end of the day. This gives us a lot of flexibility over cost. And the reason that we chose this type of infrastructure in the US is that the public health programs that we were working with were very, very cost sensitive. They wanted a software as a subscription model. They felt that they weren't able to run the system themselves, either on their local infrastructure or within their own state. So they really appreciate a cloud-based system that sort of allows them to keep the cost of operating digital adherence technologies very low. So that's how we host in our US jurisdictions. Now coming to Europe, as I mentioned, in the UK, we've actually taken a much more managed service hosting approach. The primary concern with our EU partners were less around cost and more around data sovereignty. So GDPR and UK local regulations really said data cannot leave our country borders. And so we wanted them to still have access to digital adherence technologies. And so what we did is we worked with the organizations in Switzerland and Find and Treat in the UK to help them come up with a managed hosting option where we would give them or deploy our code base. They would have a managed service provider that would come in, and it allowed us to maintain the data sovereignty requirement while also, allowing them to host a dedicated instance of our system. So they're not private, they're not using a private cloud per se, they're still using a public cloud option, but with a managed service provider in between sort of us and the government entity. And then lastly, speaking to our engagements in Africa and Asia. those have also had many considerations. Speaking to three that are that were sort of our largest deployments in Somalia and Eswatini, and with the Gates Medical Research Institute in South Africa, we had conversations around data sovereignty, we had conversations around local regulatory requirements, and we had conversations with each of these partners around cost. And so what we did is we actually decided that because the primary concern of these partners was cost, that but they were also very concerned around data sovereignty and didn't necessarily have the local public infrastructure to host maybe in-country borders, we landed on a regional public cloud. And so what's great is we now have an instance of our system sitting in South Africa. Many countries and the continent have felt at this stage that at least having a regionally hosted option was good, from having data hosted on the continent, having the ability to sign data use agreements with us that kept ownership of the data with the partner, and then also the latency concerns over hosting, for example, in the US or Europe. So I think the regional cloud was a really nice option for our partners in Africa. We're also looking at regional cloud options in Asia, Southeast Asia specifically, for partners there. So when we think about hosting in the context of digital adherence technologies, again, cost tends to be the most important implication, followed by data sovereignty when we're having these discussions with our partners. What we have found, though, is that cost is very hard to mitigate if we're looking at the private on-premise or sort of hybrid cloud options. Those are the cost implications there are very hard for us to overcome. What we found is that we can mitigate cost by using a public cloud, and then we can mitigate data sovereignty concerns with really strong data use agreements between us and our partners to ensure security and regulatory requirements are met, that we have high and robust service level agreements or SLAs, and that we ensure that data ownership remains with the government or the partner that we're working with. And so the data sovereignty concern of having data hosted in country actually can be mitigated by these really strong agreements that we put in place with our partners. And then the last thing I'll say is that from trying to move towards cloud, having a regional hosting option is also really important. It might have been a deal breaker if the only option we had available was to host in the US. And so we've been really trying to be very flexible with partners that are globally located to ensure that their data can sit closer to them, latency can be addressed, and ultimately that we have different types of instance options available for partners that don't feel comfortable having their data hosted in the US or Europe. So how do you start the hosting discussion? I think this tends to be a daunting conversation when we first open up the discussion with our partners. Some things to consider as you start thinking through the hosting conversation are to really ask, which hosting configuration aligns best with your organization's needs, and then start thinking about how can you balance control of data with cost and scalability really in your digital adherence hosting strategy. And so what I want to do is just kind of walk through an assessment example that we've used in the past. So when we start thinking about deploying digital adherence technologies, it shouldn't start with, we want to use this vendor. It really does need to start with an in-country discussion around the objectives and the requirements that you have for deploying digital adherence technologies within your borders. So thinking through, to begin with, your service goals. What are your primary goals that you're trying to achieve? So for example, what are your availability goals? How often do you need to be able to access the system? Does it have to be highly available? When I say that, I mean, do you need to be able to access it 24/7 at all times? Or is it something that you could manage maybe accessing just during business hours, for example? Also, your security goals. What are your security goals of the data? What is the cost efficiency goals that you have? So really starting out with a set of goals can be very useful. Moving next to defining your regulatory compliance. So identifying the necessary regulations that you have within your organization or the country that you're working in. What are your data sovereignty requirements? What are, For example, do you need to comply with local regulatory requirements? In the US, we have HIPAA. In the EU, they have GDPR. But also, many countries that we've been working with in Africa have their own local data privacy regulations that need to be complied with. So really defining those at the outset. And then talking through your security needs. So what are the security requirements either at your organization or within your government around things like encryption and access control? So trying to define those before you even set out on your hosting discussion. And then the next step is to evaluate the current capabilities that you have internally as an organization. So look at your existing infrastructure, assess whether or not you have, for example, maybe you have access to a private cloud. If you're, a large NGO or you're a hospital system, potentially you have access to an on-premise server system that actually could be leveraged for a digital adherence rollout. So trying to assess the current infrastructure and utilization that's available to you. Looking at your IT resources, again, I mentioned people a lot when I was talking about the different types of cloud options. Can you evaluate the skill level and the capacity of your local IT team? If you don't have them in your org, are there organizations that you can work with that are local? So trying to have that discussion is very useful. And then really having a conversation around budget before you talk to a vendor. What is your available budget for setup and maintenance? If you don't have access to a private cloud, for example, and you're going to require that your digital adherence technologies be stored in country, you'll need to really think through budget implications of that. What does that mean? What are the server and hardware costs that you're going to need to cover in addition to the software costs? So really important conversations to be having prior to even thinking about a digital adherence solution. And then getting into assessing your workload and the data characteristics. So this is kind of where you can start thinking about, okay, which digital adherence technologies do I want to roll out? So thinking through the different types of digital adherence technologies, things like, are you thinking about rolling out video supported treatment? Are you looking at the MERM boxes? Are you thinking about 99 dots or some other digital treatment support option? As you're thinking about the different types of digital adherence technologies, you can also start thinking about performance and scalability requirements that come with those different digital adherence technologies. For example, with video supported treatment, you might need higher connectivity options or higher performant server options because you need to be able to stream a video, for example. Whereas with the MERM, maybe you're just looking at a signal. And so the data requirements and the performance requirements might be lower than if you're rolling out true virtual care type solutions. And also the sensitivity of the data. For example, VST might have more sensitive data because it has a video of a individual's face versus, MERM, which can be de-identified much more easily than a video. So trying to think about data sensitivities. And then once you have, these first three steps kind of completed, then you have a full picture of what type of digital adherence technologies are there, what infrastructure is available in your country to date, and how you're going to start making that decision. Then you can start exploring and comparing hosting options. We found that the first best option is to look at your existing infrastructure, your IT capacity, and your budget priorities, and actually start by ruling out any no-go options. That way, you're not trying to put all these things on the table at once. Just look and say, okay, these things are completely off the table based on what we have available and what we're willing to or have budget for. And then once you can rule out the no-go, then you can start reaching out to digital adherence providers to determine which vendors can support the possible hosting options that are really left on the table. And maybe what I'll say actually before I move on to the last slide there is that, as a digital adherence vendor, we are very often having these hosting discussions with partners. And if it's not possible for Assured here to or Dimagi to support a required hosting configuration, we love helping you get connected with a different digital adherence provider. I think it's really important to us that access isn't the issue, that if we can't support it because of a technical reason or cost reason, that we actually help you find a vendor that can support your hosting configuration. So I think really this is about finding the best option for you as a country or as an organization. And then the last thing I'll say is that this now gives you a chance to make an informed decision, compare your findings, kind of weigh the pros and cons of all the options on the tables, and consult with stakeholders as you're making a finalized choice about both hosting and a digital adherence vendor. So this is just a sample assessment. Job, after the webinar, I'm happy to share We actually have a longer version of this, and it can be made available. And then I also just linked in a couple of resources there to some of the providers that I mentioned in the presentation. So happy to open it up now for questions.
Great, thank you so much, Kelly. I will take control over the slides now.
Okay.
Yeah, thanks so much for so clearly outlining this whole spectrum of hosting options available and some of the pros and cons in certain situations. And definitely great to hear about like all the experience that you have with Dimagi and shared here in different continents on how you provide different hosting solutions that fit the context best. There are indeed many options available, and it's clearly there's no size fits all. So that is also for today. Let's talk about all these options and what fits best. Because I'm interested about the technical capacity that is needed in some of these solutions, especially if you look at the most left and right side of that spectrum. We talk about on-premise hosting versus like global public cloud hosting. I think overall on the internet, we see that there is, at one hand, there's more cloud services available than ever before. Many countries, many organizations, they move with their data into the cloud. But at the other hand, I think in several of the low and middle income countries that we all work in global health, that we see that the digital health strategies and the policies in place, that they are starting to mature a lot more. And there is indeed a focus on country ownerships, which is very important. Can you reflect on how you see the local capacity that is needed for on-premise hosting or in-country hosting in terms of, is that increasing or diminishing within some of the countries that you have worked in?
No, that's a really great question, Job, and I think a really pertinent one. So we've actually seen that the capacity for hosting internally is growing. And I think that we're starting to see a maturation of, kind of going from this old school idea of on-premise being like a server sitting in an office, for example, or under your desk. That concept is starting to go out to more when we talk about on-prem. What we mean is pretty typically, kind of that hospital data center or a local data center that's within your organization, or even perhaps the government has a data center that can be leveraged that's hosting government level data, for example, tax data or social security type information, or those types of options are available in many of the countries that we work in. And there are local IT skill sets and capacities that are available to sort of be leveraged to host the data. And so I think health related data, especially when we're thinking about TB program data, if that type of solution is available in a country, I think that there's clearly the technical resources available to be leveraged. There's internal capacity within many countries to be able to support that. And so as a digital adherence provider, we really do want to support the data ownership requirements. And so I think that our goal would be, if those services exist, to try to work with those local providers. And we are seeing that grow. So I think over time, maybe 10 years ago, that wasn't necessarily the case. But I think today we've absolutely seen maturation in that area. And when we're talking about on-prem, it's typically like a private cloud or a government cloud that we're looking at, not necessarily on-premise at an office per se.
Yeah, thanks for your reflections there, Kelly. Okay, thanks so much, Kelly, for your presentation so far. Then we move to the second part of the webinar today. This will be presented by Vasile Bounegru. Vasile is a digital health expert. He serves as a senior expert in interoperable healthcare systems and health software and mobile applications for the Center of Health Policies and Studies, the PAS Center in the Republic of Moldova. Vasile has over 14 years of experience in project design, technical documentation, capacity building, and digital adherence solutions, and much more for the national TB program in the Republic of Moldova, but has also worked for the TB programs in Romania, Armenia, Tajikistan, Georgia, Uzbekistan, Kyrgyzstan, and Turkmenistan. Since 2017, he has supported the implementation and expansion of the VST, supporting people with TB across the region. And since 2023, he is coordinating the development of the information system for TB monitoring and evaluation in Moldova. Before I hand over to you, Vasile, Yeah, thanks so much for joining us today. And I think also what we heard from Kelly about all these options out there, you will also outline a bit on some of the technologies that are available. But we're also really interested to hear, of course, from your experience in the Central Asia region, where you have worked in so many countries in TB control. With that said, Vasile, I will like to hand it over to you. You can take control of the slides and kick it off.
Okay, thank you, Joop. Dear audience, dear colleagues, good morning. My presentation is aimed at providing you some insights and practical information about the hosting options to select a DAT platform, and with a case study of the Moldovan experience in implementing VCT and the use of the alike VCT platform. As you may see from the outline of the session, we will go through pros and cons from different hosting solutions. We'll present the most important factors that could influence a country decisions for one or another hosting option, the required steps to follow for choosing a more suitable option, and last but not the least, the VCT experience of the Republic of Moldova and other countries. At beginning, we can highlight that there are 3 types of hosting options suitable for DAT platform: global cloud hosting, local in-country cloud hosting, and the NTP or implementing partner owned server. Moving on, next slide, we can see the pros of each hosting solution, and we can highlight that the positive aspects of the global cloud hosting are mainly linked to the higher quality resources. Some hosts have 24-hour support, may easily scale computing resources up or down. Cloud servers often use redundant hardware and data centers to provide high uptime for critical applications, ensuring they continue to function even if hardware fails. For the local country cloud hosting, the number of positive aspects is significantly higher, and we can relate to the low latency, optimal solution for hosting sensitive data, limited number of privacy laws to comply with, lower chance to get a fine due to the breaking privacy protocols. It is in the same time zone, operates during country's working hours, no need to sacrifice speed for cost. It's familiar with local networking or power issues and may provide contingency if required. It can be obtained for free and no dedicated physical space required. As the third option, the positive characteristic could be a large website with high traffic and a huge user base, offer outstanding processing power, memory, and storage capabilities, ensuring optimal performance for resource-intensive applications and websites, may add more storage space and bandwidth if necessary, reliable performance, has a high security with minimum risk of the resource contention. The owner has a full control over server configurations and software installations. Considering the above mentioned pros, we can see that there are a number of cons for each hosting option. Mainly of the global cloud hosting has data stored offsite may raise security and privacy concerns, limited controls over infrastructure and customization, potential downtime and reliable on cloud service providers, and data transfer costs are high. If we describe shortly the most common cons for selecting the local in-country cloud hosting, then you may see that there is a limited allocated resources, limited control over infrastructure and customization, potential downtime and reliance on cloud service provider, lengthy and bureaucratic process of obtaining hosting. If the first 2 options imply both cloud hosting, then the third option is focused on the physical servers. This involves expensive hardware and maintenance, increased complexity, is challenge to maintain hardware, software, and security configurations. Moreover, this option may consume more energy and resources, and of course, a dedicated special room for these servers. Moving on the next slide, in case a country would select the first option, then it's important to consider if there are national legislation and policy in place to allow externalize the sensitive data outside the country, which is unlikely. Therefore, the first option may be acceptable if country decides to implementing the DAT solution, such as smart pillbox. If it's not appropriate for VCT due to low security and high cost data transfers. Speaking about second option, then I would say that in my personal experience and practical knowledge, this is the most optimal decision for both VCT and smart pillbox platform. For example, in our case, Moldova. The third option is also a very good one if you consider the need of a large hosting space for VCT videos and personal data. Also, it's very secure in terms of a dedicated storage space or room and absolute control of the implementing partner over the server administration. Therefore, the third option would be optimal for smart pillbox, but as well, if there are resources to buy and keep a number of servers during a long term, then that could be adequate for VCT implementation. When countries evaluate hosting options for DAT solution in the context of TB management, several critical factors come into play. First, data sovereignty and privacy. For data sovereignty, the countries must decide whether to host TB-related health data within their national borders or utilize external cloud services. Data sovereignty ensures compliance with local privacy laws, but may limit interoperability and exchanges. Privacy concern, hosting data locally provides better control over patient information, reducing the risk of unauthorized access. However, it also requires robust security measures to prevent breaches. Second, infrastructure availability and reliability. For the local infrastructure, countries need to assess the availability of reliability of local infrastructure, data centers, network, power supply for hosting DAT solutions. Reliable infrastructure ensure uninterrupted service delivery. For cloud servers, external cloud providers offer scalability and goal reach. However, reliance of international infrastructure may introduce latency and connectivity challenges. Speaking about cost consideration, there are local hosting costs and cloud hosting costs. For the local hosting cost, we may mention that implementing and maintaining local servers involve expensive related to hardware, software license, and skilled personnel. This cost vary based on the country's economic context. For the cloud costs, these are related to subscription-based pricing models, and the country shall compare the total cost of ownership between local hosting and cloud options. Security and compliance, regardless of the hosting choice, or robust security practices are essential. Encryption, access control, intrusion detection, and regular audits mitigate risks. Additional to this, the country must adhere to local or international regulations when handling health data. For example, the cloud provider often comply with these standards. Scalability and flexibility. For the scalability, the countries need to consider the expected growth in TB cases and patient data in time. Cloud solutions offer dynamic scalability, while local server may require capacity planning. For flexibility, cloud services allow rapid adjustments based on demand, while local infrastructure may be less flexible. Interoperability and integration. For interoperability, ensure that DAT solution can seamlessly integrate with existing health systems, electronic health records, and other relevant platforms. For data exchange, the countries have to consider how easily data can flow between different systems and providers. Risk management and contingency planning. For risk assessment, the countries have to evaluate risk associated with each hosting option. What happens during server downtime, data loss, or cyber attacks? For disaster recovery, the countries have to have in mind developing a robust disaster recovery plans to minimize disruptions. Local expertise and support. If we speak about the technical skills, then the local teams need expertise in managing servers, databases, and security. Training and capacity building are crucial. But also the support availability is crucial, especially having at hand the technical support during emergencies. So in conclusion, countries must balance factors such as data control, cost effectiveness, security, and scalability when choosing hosting options for DAT solution in TB management. Each context is unique, and the decision should align with the country health protocols, priority, and resources. The next slide is showing the most important steps that country needs to follow when deciding on the best suited option. First step one, assess country goals and objectives. That means to clearly define the purpose of implementing DATs in TB management. What outcomes do you aim to achieve? Consider treatment adherence, patient monitoring, and data accuracy. Step 2, understand stakeholder needs. This implies to engage with healthcare providers, patients, and other stakeholders. Also, it's important to understand their requirements, pain points, and expectations regarding DAT functionality and accessibility. Step 3, evaluate data sensitivity and privacy requirements. Step 4, analyze infrastructure availability. The country will need to assess the existing infrastructure, local data centers, networks, power supply for hosting DATs, evaluate reliability and scalability. Step 5, cost-benefit analysis. The country will need to compare costs associated with different hosting options, global hosting, in-country local hosting, dedicated physical hosting. It's important to not forget about the setup cost, maintenance, and long-term expenses. Step 6, security and compliance considerations. The country will need to evaluate security measures for each option. How will data be encrypted, access controlled, and monitored? Ensure compliance with local and international data protection regulations. Step 7, scalability and future growth. It would require to anticipate the growth in TB cases and data volume and to choose a solution that can scale without major disruptions. Step 8, interoperability and integration. The country will need to ensure that DATs seamlessly integrate with existing health system, electronic health records, and other relevant platforms. Step 9, risk assessment and contingency planning. The country will have to have a robust contingency plan developed by identifying as well the potential risks such as downtime, data loss, cyber threats, and others. Step 10, local expertise and support. It's imperative to have a view of existence and availability of skilled personnel for server management and technical support. If not, then it needs to plan additional costs related to a professional training to prepare such human resources. Last but not least, the country will need to engage in collaborative decision-making, meaning to cooperate with relevant stakeholders, government, health departments, NGOs, technology partners in the decision-making process. Now I'm going to highlight the most important aspects of the VCT implementation in Moldova. And as you can see the slide, the initiation has begun almost 10 years ago with a VCT pilot project. The pilot results showed that compared to DAT, the VCT decreased significantly the cost and time spent on the treatment, while the patient satisfaction increased. In 2018, with donor support, the Like VCT platform has been improved, and in 2019, the platform was ready to be used at national scale. In 2020, the COVID-19 pandemic speed up the process of implementing the VCT, and this was a major milestone for Moldova. From 2021, the Allied VCT has been scaled up at the country level. With the donor support, the CSOs have been actively involved in providing assistance to both health staff and patients, while the funding covered the training, equipment, the internet costs for patients, and software maintenance. Here you can see some features related to VCT implementation, and I can proudly mention that at this moment, the adherence of the patients in Moldova is more than 90%. Of course, to conclude, there were several challenges in the implementation of the platform, linked to the lengthy bureaucratic process of registering the system at the National Personal Data Protection Center, use the platform by patient who lives on the left bank of the Dnistru River, and the lack sufficient financial resources to timely improve the platform and make it fully functional. As for the lesson learned, a close interaction between NTPS as national implementing partner and NGOs is the provision of TB services, contributed to an effective use of the platform and an increased patient adherence. Beside the experience of the Republic of Moldova, there are other countries that have chosen to implement the Like VCT platform model. Is Uzbekistan, Turkmenistan, and Tajikistan. So all three countries have decided to select the hosting option on the NTP implementing partner owned server. Since 2022, Uzbekistan and Tajikistan have started the implementation of the platform and currently are in the process of scaling it up at the national level. Meanwhile, Turkmenistan has started the implementation early this year, but with a significant and unique model of the platform, becoming possibly the first country in the world that will have hybrid DAT solution, which include in one single platform two options, VCT and Smart Pillbox. What does it mean? It means that the implementing partner or medical staff will have the opportunity to choose a personalized approach for each TB patient, depending on the case. For example, availability of smartphone, internet speed or connection, technical capacity of the patient to use the mobile app, age of the patient, and other. For Turkmenistan, I'm looking forward to see how this platform will be implemented at the national level and what will be the challenge and achievements. Thank you for your attention. If there are any questions, I'm happy to provide more details.
Great. Thank you so much, Vasile, for your clear presentation. I think it's especially interesting to hear also your opinion on what type of hosting solutions are optimal for what type of digital adherence technologies. Because of course, today we talk about a lot about the hosting options, but we are not so much talking about the technology. But it's of course linking the technology that you want to use with a platform that's suitable for that, and then next to that, make sure that that also fits in the right hosting solution. So thanks so much, Vasile, and also your experience in some of the countries in the Central Asia region. Looking again at the Q&A sections, I don't see a specific question for you yet. So I would like to kick it off again. I think the topic that you touched upon on integration and interoperability is quite important, both between systems as well as between different digital adherence technologies. Maybe you can say a little bit about the example of the iLike VST application for video-supported treatment, where you recently have worked on the integration of smart pillboxes within that platform, the challenges or the opportunities that you see with interoperability of the technology there.
Yeah, thank you. In Moldova, we are using the local in-country cloud hosting. We have governmental cloud, is very performant, and he has many tools. Our digital health is now at on high level. We have primary, we have hospitals, and now we're working on another tools for TB monitoring, and we have a lot of tools for integrations, and also in VCT, it's is also in these systems, and is hosted on cloud governmental hosting. For VCT Turkmenistan challenges, in country we have a low speed internet and coverage, and we introducing now the smart pillbox, which is a good opportunity for them to have in VCT possibility to monitoring the adherence of the patient. Maybe for futures, if the country will have a good internet coverage, they will have the opportunity and they will have the functionalities to use smartphones, to use video supported treatment for these patients. So I recommend to have this better solution, to have a local in-country cloud hosting. If it's governmental, it's perfect, but it's difficult to have space on these servers, but it's possible. If not, I recommend to use our NTP server or partner-owned server, which is it has a high security and minimum risk to the resource contention. Also, the owner has the full control over server configuration, software installation.
Yeah, thanks so much, Vasile. Important considerations there. Great to hear your experience. I do see a question in the chat. Shall I just read it out, or we can allow the person to speak up?
Hi, and good morning, everybody.
Hi, Amma. Nice to see you.
Hi, Joe. How are you? Hi, Kelly. Hi, Juan. So yeah, my question was, in Somali, we're using the Sure Adhere platform. So I was happy to hear Kelly presenting because we're using the platform. So my question was, now that we're using the public hosted in South Africa, we're considering the sensitivity of our data. Can you elaborate more on the specific measures that maybe the Sure Adhere platform is putting in place in order for us to continue using the VST? And how do these platforms ensure compliance and local international data protection regulations? And I was wondering about the access control and the monitoring of the data recovery, because of the sensitivity of the country. And now that we're thinking maybe we'll use more on the VST. And then one more question, even though I didn't add, I wanted to ask, there's a lot of different servers that I think Kelly presented as well. So in order to sustain it, what is the future of sustaining maybe this technology will look like in a country who started using the public server, maybe because of financial and all of that, but what will it look like in order for us to sustain it in the future? Thank you so much, and good to see you all again.
Thanks, Emma. That's a wonderful question and very much appreciated having you ask. So in terms of the security protections that Shared here puts in place, so security is really of utmost importance. So we kind of take security both on our software design process as well as on the back end when we're thinking about how do we, protect data from a firewall and, data protection standpoint. So on the front end, we do encryption of all of our data, both at rest and in transit. So for example, when a patient takes a video using their mobile device, that video is then encrypted right on the mobile phone, and then it's sent up in transit. And actually we delete the original video that was on the device, so that video never sits on the device for any longer than it takes to actually upload to the backend cloud. So I think really important that we encrypt it, we send it, and then we delete the one that's on the device, and we keep the one that's stored in the cloud that's encrypted. So really, I think just from the outset, we make sure to secure those videos. From the standpoint, once we have the video, we also have data deletion policies in place that allow us to keep the data related to adherence and treatment support, but to not keep the videos long term. So our default policy around keeping videos is to just keep videos for a period of between 30 and 180 days. Then those videos expire, and then we purge all old patient videos from our system. Now that policy is really dependent on the country and the policy around keeping videos for each partner. So we can sort of modify that policy based on how the partner feels. So again, kind of taking phone level, server level access around videos and expiration of videos after a certain amount of time, while still maintaining the integrity of the the adherence data and the treatment data that's so important to making sure that you've got treatment outcomes, for example. And then from the back end, when we're thinking about how are we protecting the infrastructure, so our systems are HIPAA compliant, GDPR compliant, which means that we actually have we go through audits, internal and external audits around HIPAA and GDPR, and then also SOC. So Dimagi is a SOC 2 certified company. Shared here just went through our SOC 2 Type 1 audit actually this year. We're going through SOC 2 Type 2 next year. And that means that we maintain really strict data security policies and privacy policies internally at Dimagi. And then all of our practices are audited against these policies with an external auditor. So we take security very, very seriously at Dimagi. Data ownership and integrity are also very high on our priority list, right up there with sort of our security policies. And I think that as a company or as a vendor, it is very important to us to make sure that all of these practices are externally seen by our partners, that you can talk to us and see our audit controls that are in place. We're very transparent with our SOC controls. And so I think that those are, again, very important of any vendor that you work with, to really think through, like, what types of regulations are you compliant with, and are you audited against those? So maybe that's an answer to your first question. Your second question, I think, is around scalability and long-term sustainability. I'm just going to answer from my personal perspective. I think really important that there's probably, Vasile has probably a different perspective, or I'd be very interested to hear his perspective on sustainability. When we think about sustainability, our team is actually sort of determined that having a multi-tenant cloud instance can be more sustainable in the long term, because many individual organizations are sort of utilizing that cloud-based environment. So if one over time, the hope is that the cost would continue to come down to make this more sustainable to use over the long term, as opposed to trying to host internally in country and then having those costs go up over the long term. So I think when you're starting to think about scalability and having things hosted in a multi-tenant instance in the cloud, as you bring on users, the cost ideally can come down over time as opposed to going up, and that will hopefully help drive that sustainability. And additionally, to try to continue building in new new features that are of value to all of our partners to really continue to increase the value of the system, and really think about how can we, adapt, for example, any new technologies that are coming out, again, trying to make the system itself more sustainable, and have costs, go down over time as opposed to up. So that's the way that we're approaching sustainability, but I imagine there are many different perspectives on that.
Thanks, Kelly. Really appreciate your answer. And I think on the first part, it's indeed the safety, security, data confidentiality is such an important topic when we talk about digital data, especially when we talk about video supported treatment, where there are patient videos that we talk about. I appreciate the fact that you also say that all the compliances that Surety and Dimagi has in place, and also transparency in terms of the audit reports that can be shared. I think it's an important part of your strategy of communicating with those that are using your services. On the sustainability part, it's really interesting indeed to hear your opinion there, and also looking at the future. Where is this going to? Maybe Vasile, would you like to share your opinions on this as well? Because in your presentation you said there's sometimes more of an optimal situation for certain countries, somewhere in between over cloud and in-country hosting. Can you provide your perspective there? Please unmute yourself.
Yes, thank you. For scalability and flexibility, I think the countries is decision about the countries which type of hosting they needs to implement. It's depend about of the platform using and implementing. For example, the VCT. It's for VCT. It's need to have a more space and a more a good internet provider, and to use a cloud outside the country. I think it would be a risk because we're using a sensitive data, we're using video, we're using audio. Of course, you need to check local laws about data protection, because more system using systems outside the country, but they don't have any idea how to implement our local his local law. But for better solution is to have a cloud services at national level to allow a rapid adjustment based on demand, while local infrastructure may be less flexible. If they don't have on local cloud, they could use a local server. I think it's more in perspective of security. It's a good choice. It's my perspective.
Yeah, thanks, Vasile. And indeed, I think there are multiple perspectives, and maybe the final point here is that there is definitely not one size fits all. I think I've heard you both say that, and I think it's also our job from the Global DAT Task Force to say these are the solutions out there. These are the considerations you can think about, and together with software vendors, with technical partners, as a country, you can make a decision based on what fits well also with your local regulations. So thanks so much for your reflections there. I do not see any questions in the Q&A at this moment in time. So I think we are going to wrap up the webinar for now. I do have 2 or 3 more slides to do so. Forward. Okay, great. So from the Global Task Force, I would like to say that we have been providing support to several countries over the last couple of years in the different phases of planning and implementing or scaling up their adherence technologies. If you as a country are interested to be supported by the Global DAT Task Force, please reach out. We can help you out with budget development, proposal development, but also, of course, selecting the vendor, selecting the software, selecting the platforms that are out there. You can refer people to our website. I'll show the link later on, where you can contact us from KNSV and the task force directly. But feel free to also reach out to Kelly and Vasile if you have any follow-up questions. And lastly, I would like to thank both our speakers, Kelly and Vasile. Juan, thank you so much for monitoring and facilitating the rest of the webinar. If you want to get in touch with us, please do so at secretariat@tbdigitaladherence.org. That's from the Global DAT Task Force, or you can scan the QR code on your screen. With that said, thank you all so much. Hereby, let's end the session for today.